The cervical plexus is formed by ventral rami of the upper four cervical nerves. The ventral ramus of C1, after gives a communicant with the ventral ramus of C2, unites with the hypoglossal nerve and gives three branches: branch to geniohyoid muscle, branch to thyrohyoid muscle, and the superior root of ansa cervicalis. The inferior root of ansa cervicalis arises from the ventral rami of C2 and C3 and unites with the superior root to form the ansa cervicalis. From ansa cervicalis arises four branches: branch to superior belly of omohyoid muscle, branch to sternothyroid muscle, branch to sternohyoid muscle, and branch to inferior belly of omohyoid muscle. From the interconnecting loop between C1 and C2 arises the following nerves: communicating branch to vagus nerve, branch to rectus capitis lateralis, branch to rectus capitis anterior, and branch to longus capitis. From the ventral ramus of C2 arises branches to longus capitis and longus colli muscles, and the lesser occipital nerve. C2 and C3 ventral rami are also united by way of an interconnecting loop. From this loop arises the transverse cervical nerve and the greater auricular nerve. From C3 and C4 arises the supraclavicular nerve. From C3, C4, and a small contribution from C5 arises the most important nerve of cervical plexus, the phrenic nerve, which supplies the diaphragm. C3 ventral ramus and C4 ventral ramus give branches to longus capitis and longus colli muscles, and nerves to scalenes and levator scapulae muscles. To conclude this video, we will discuss about the nerve point of neck, which is a term used in head and neck surgery to describe the point on the posterior border of the sternocleidomastoid muscle, where the four cutaneous branches of the cervical plexus emerge from behind the muscle. This point is located approximately at the junction of the upper and middle thirds of this muscle. The cutaneous branches emerging at this point are the lesser occipital nerve, the greater auricular nerve, the transverse cervical nerve, and the supraclavicular nerve. Keep in mind that these four branches are the only cutaneous branches of cervical plexus. All the remaining branches of cervical plexus are motor, with the sole exception of phrenic nerve, which is a mixed nerve.